hormones and other things. So let's drill down to at least take a look how much, when, who should be taking, and where do we really get it from, and how is it really made in the body. Hi, I'm Cosmic Mike. So, vitamin D, first thing I would say is it really a vitamin or is it a hormone? Because vitamins are substances that we cannot make in our body, so we have to take them through our diet, and the body converts those into vitamin A, vitamin B, vitamin C. But in the case of a hormone, the body makes hormones internally and then spreads it across the different glands or different organs so they can be used. Now let's take a look at it. Vitamin D we're really getting it mostly from the sun. So let's see, how we convert that sun rays to vitamin D. So we are exposed, our skin is exposed from the sun rays, and the sun rays convert a particular substance in the skin is called 7-dehydroxycholesterol. Now you see the word cholesterol, so it's a particular type of cholesterol where it reacts with the sun rays and it converts it. So the 7-dehydroxycholesterol is known as the pro-vitamin D3, and it reacts with the sun UV rays. It's converting to the pre-vitamin D3. Now it takes it to the liver by binding it through a protein. In the liver, a certain enzyme reacts with it. It converts it into 25-hydroxycholecalciferol. And this is still not the active form of vitamin D3. Then again, it binds to a protein where it gets into the kidneys. Here, there's an enzyme that reacts with it. Now it's converted to 1,25-alpha-hydroxycholecalciferol. This is your active D3 where your body will absorb. So it is the end goal. It is in the kidneys where the D that was absorbed or it will convert it, and from the sun it ends up into the kidneys where it's more likely to be absorbed, and from here on is sent to at least 33 different receptors, what they have found, that use the vitamin D for its benefits. So it gives out all its benefit to these particular sites. And let's take a look at some of these sites. The thyroid, adrenals, your pancreas, your colon, your muscles, your breast. 33. So it's very essential, as it shows that it's not only for bones, but it's beneficial for all these particular glands or organs. Now let's take a look at this, the sources. Of course, the sun is the major source of vitamin D. So that's the sun. We are converting it, as we discussed before. Then, diet is very limited, as we get some from particular types of fishes. The cod is your main fish where there's a natural source, the cod liver oil. So as you may have known, in the 70s, we were drinking as kids, of course, we were drinking some cod liver oil, that 7 C's as a matter of fact. So that's a very small amount. Salmon, mackerel, very tiny amount. Egg yolks is another source, so please eat the whole egg. Mushrooms, some mushrooms, and vegetables, of course, very tiny, maybe 1% of that vitamin D3 that's coming through the diet. And because of the issues that happened in the early 1900s, a lot of you will be familiar with rickets, where they found in the northern hemisphere. A lot of the young kids were, with the disease rickets, and they basically eradicated that disease with fortifying foods with vitamin D. And the symptoms they were having, of course, stunned growth, muscle wasting, and deformed legs. But it was totally, eradicated with them taking the vitamin D. So what they decided was to fortify milk with vitamin D. So right now, in our current times, we have a lot of foods that are fortified with vitamin D. Your cereal, some, the protein bars or something, definitely milk, and your oats. So you need to look at the labels. There are a lot of almond milk, oats milk. So everything is fortified with vitamin D. Now let's take a look at who could be deficient. Why would we be deficient in vitamin D if we are exposed to the sun? Because a lot of people say, I'm exposed to the sun, I'm in the sun a lot, or I live in the Caribbean, like I'm from Jamaica. So why would we be low in vitamin D? And this is a fact where they're finding a lot of studies with a lot of general population very low in vitamin D. And The issues comes with, first of all, if it's coming from the sun and it's converted in your skin, the darker the skin, the melanin, it's blocking those UV waves. So it's not necessarily converting that cholesterol, the dehydroxycholesterol, into the pro-D3. So darker the skin, less likely for you to convert. The lighter the skin, of course, you will be converting more. But the time of exposure in the sun, are you really in the sun out there? With our current modern life, we are in our jobs, in our homes, in our cars, and so different places of the earth where different cultures where they wear full body clothing, where they're not exposing any part of the body, so lack of exposure, in those cases. Now, it may not be overnight, but it may be through generations and generations of that. Likely generations where your parents had a deficiency or your mother had a deficiency, and you are more likely, and of course your kids are definitely more likely, and this is what they're finding. So more and more people they're finding with less vitamin D. Of course, there are pockets in the world where there is no vitamin D deficiency, but mostly there is a widespread of vitamin D deficiency. Let's take a look at something else. Now, if you looked at the vitamin D that gets converted to the liver, in the liver and the kidneys, which brings or makes the active D3. So what if you had a liver or a fatty liver? What if you had a compromised liver? What if you had kidney stones? What if you were on dialysis? What if you already had a compromised kidney? So again, if these issues were in these organs, then you're less likely to convert that D3 from the sun to the active form where it could be absorbed. That's another situation. Now, the other situation, I would say, there's a lot of absorption and lack of absorption in the gut. Anybody with IBS, leaky gut, Crohn's, celiac, all those are less likely to absorb that vitamin D3 that's coming through the kidneys into the bloodstream, getting into your system. So there are different reasons why you could be, obesity. Obesity definitely because there's too much fat tissue around. So the vitamin D, being fat soluble, gets stuck or stored into those fat tissues and less likely to be released into the bloodstream to be absorbed. Medication, there are a lot of medications that may be blocking the absorption of vitamin D3. So you should be definitely be looking at, if you're taking medications for any other reason, to kind of see if, ask your pharmacist or your doctor to kind of see, if this is blocking that vitamin D3. Now, certainly, skin disorders. Because skin is the major platform where it gets absorbed and gets converted. So if you're having skin disorders, any kind of skin disorders, then definitely you are not getting that vitamin D3. So there are many reasons where you could be lacking vitamin D3. Of course, finding out how or why you're lacking. Finding out if you're lacking, the best way, of course, to get your test done. Now, just bear in mind that each lab is going to have their different average that they go by. But generally speaking, the average, and of course it matters with female, male, the different age groups. The elderly less likely to absorb the vitamin D, and of course more likely to have low vitamin D levels. 25 to 30 ng per ml is optimal. It's basically required to prevent the rickets, which happened in the 1900s. But do we really want to be at that level where we want to just avoid a disease? We want to be an optimal level where it's helping with these receptors that we just talked about, where all these organs they're using that vitamin D3. So the optimal level that I've seen and looked at the studies, between 70 to 100 ng per ml, and that would be your optimal levels. Beyond that, there could be an upper limit. But there's a lot of research. There's also a lot of contrary research where higher levels are not toxic, and we're not going to go right there. But I think being at 80, 90, or 100 ng ml is pretty good. So that's your average, but every lab is going to be different. So please, take a look at that. Talk to your doctor. Get their opinions and stuff. So this is the best way to understand. If you're low, then you supplement. And let's take a look at the supplements. The supplements, of course, you have been taking the supplement. A lot of you have been taking. There's 1,000 I use. We have 1,000. I have those bottles right here with me. 1,000, 5,000. It also comes in a 10,000 I use, where some of the doctors are recommending where you take once a week. So remember, this is fat soluble. It gets stored in the tissues. Your body can release it slowly. So in the supplements, it does come from cod liver oil. That's the majority of them. And you'll see these tiny little soft gels with the oil. Definitely those should be taken with food, because any fat taken with food in your gut, it's more likely to absorb and better absorption. They do come in vegetarian capsules. Now, vegetarian capsules where you do not want the fish or you do not want the gelatin that comes from pork. So there are some vegetarian sources. There is one likely source, which is sheep lanolin, which is basically when they shave off the wool off the sheep, there's a wax substance, and that has some vitamin D3. I'm not sure if that's really vegetarian, but there is that source. Now, the other source I would say is Saccharomyces. It's a bacteria where they manufacture this in the lab and they make that into a D3. You should look that up. It's more of a vegan source of the vitamin D3. But general vitamin D3 that you see in the supermarkets and your supplement stores and our shelves also, it's going to be cod liver oil. Now, we do carry all different sorts of these. We have different because we have different people that are asking for different ones. Then there is a sublingual form. I prefer the sublingual, which is basically putting something under your tongue. If you have taken some homeopathic medicines in the past, you understand what is sublingual. I think that's a better absorption because it gets to the systemic circulation pretty to the circulation pretty well. So it bypasses your stomach, it bypasses your liver, kidneys, because remember we looked at if you had a liver issue, a kidney issue, or even a gut issue, you're less likely to absorb that vitamin D3. So just putting it on the tongue and getting it into the system may be a better option. Now let's look at the dosages. Of course, it all depends how low you are, where your numbers are. When we talked about those numbers, once you get tested, I wouldn't just randomly take. But there are studies done, like in this situation with the virus, where high doses of vitamin D does prevent some viral infections. It does boost up your immune. It helps with cell growth. So it has also helped with bones. Of course, that's the main reason a lot of people, taking vitamin D, because there's a lot of research where it talks about calcium and phosphorus absorption into the bone. 25% of cancers, where it prevents a lot of growth of those cancers, especially breast, prostate, colon. A lot of studies out there, and I've done that in my blog, but I've kind of referenced those studies. Diabetes, where it prevents the insulin. So again, helping in a lot of different ways. Kidneys, because it's coming through the kidneys. Dental, stronger teeth, stronger gums. Depression. A lot of little studies out there that it helps with depression. They've found that kids or teenagers with depression have low vitamin D. And of course, people with cancer, they're found with low vitamin D. And high blood pressure. So there's a lot of different places that it can help. So you could be more likely be deficient. But a test would kind of give you, the whole answer right there. Chemotherapy, if you have gone through chemotherapy or any kind of, I think, organ surgery, where digestive surgery, you could be lacking because there could be a problem with the absorption. So you should be definitely taking a look at that. So this kind of sums up, the vitamin D3 topic. If you guys have any questions, please put them on the Facebook Live comments. Let me know. I know you guys are everybody takes the vitamin D3. I take it usually with food in the morning. It can definitely be taken at night because it does not stimulate you, so it doesn't do kind of excite you or anything. So you can take it with food in the morning or at night. Liquids, they are drops. Usually a drop is 1,000 IUs. So just take a look at that. For babies also, they have little drops. They can do that. Of course, it is fortified in the milk, and so I hope we covered a little bit here. You can look at my YouTube videos we have done and my blogs on vitamin D3, where we go deeper into vitamin D3. So please, I would love your questions and any